Welcome to This Week in Health IT. It's Newsday. Today, Haven's End, Optum grows, vaccine distribution, CIO role for 2021 and beyond, and caring for our aging community. We hope to get at all those stories. We'll see how well we do. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Special thanks to Health Lyrics, who is our Newsday sponsor. That's my company. And I do executive coaching for CIOs. If you're interested in that, check out healthlyrics.com. If you want to be a part of our mission and become a show sponsor, send an email to partner@thisweekinhealthit.com. Quick note, we launched a new podcast, Today in Health IT, where we look at one news story every weekday morning. Check it out. Subscribe wherever you listen to podcasts. All right, today we introduce one of our recurring guests for our Newsday show, Sue Schade, former CIO of the year. I love that title. And principal at StarBridge Advisors, a health IT advisory firm. Good morning, Sue. Welcome to the show.
Morning, Bill. Thanks for having me. I'm looking forward to this.
Yeah, I'm looking forward to it. Yeah, Happy New Year to you as well. Did you have a good break? You feel like you're rested and ready to go?
Good. I did. Took the week off between Christmas and New Year's and tried to relax.
It's interesting. We're always out of our house. And being at home used to be like, hey, I'm away from work, but it's not that anymore. Do you find it hard, or did you leave your home?
Left our home to do errands and to take gifts to kids, and with masks on, stay a short while and open them and come home. But yeah, we stick close to home. And my husband's retired, so he said, if you have trouble relaxing, just follow me around.
follow my lead. When I sleep, you sleep, and you're like, you're sleeping at 2:00 in the afternoon. It's like, yeah, that's what we do when we're retired. No, that's fantastic. All right. So you've been a guest on the show before, but this is a little different. You and I are just going to go back and forth on some news stories. And what we're trying to do, the goal is really to provide health IT staff with some context on the news stories and try to frame it through a health IT lens and, just see where it goes. So I'll kick us off with the first story, and then we'll just go back and forth. The first story, I think probably the biggest story of the week. It's hard to say what the biggest story of the week is. Obviously, there's a big story in the nation's capital, and we're not going to hit on that because there is not a health IT implication. But the biggest news stories in health IT, gosh, it's hard to say. I mean, you have so much going on. Haven's End, though, is probably the one that got the biggest press. And that is, here's a little excerpt from the Wall Street Journal, and that is a healthcare venture launched with great fanfare by three of the world's most prominent companies, Amazon, Berkshire Hathaway, and JPMorgan and Company, and their chief executives, is folding about 3 years after founding. Haven Health, sparked by an idea of JPMorgan chief executive Jamie Dimon and supported by Amazon's Jeff Bezos and Warren Buffett, sought to transform healthcare and reduce costs for hundreds of thousands of workers at three companies by pooling their resources and technology. That was not only what they were talking about. They were also talking about, hey, we're going to do this for us, and then we're going to take this out to the market. So there was a lot of excitement around this, and it's come to an end 3 years later. I'll let you get the first comment on this, and we're actually going to go to our LinkedIn post as well and get some comments from there. What's your takeaway from this event?
So yeah, big story of the week in healthcare, at least. I was never probably as optimistic about this organization and what it could do as you may have been. I remember reading and hearing, what you had to say 3 years ago. Healthcare is complex, as we know, to quote someone who said, who knew it was so complex, right? And some of the stuff I've read since Haven is ending talked about the silos, and we know in healthcare silos don't work. They just don't. I wanted to be optimistic. And when Atul Gawande was named to head things up, I have incredible respect for him. I think he is quite a visionary as well as very practical in terms of the challenges of healthcare. But it just, they didn't make it. They didn't get too far. They did some pilots apparently themselves. I think that taking as long as they did to name it probably was a bad omen. So I wasn't that optimistic. I am disappointed that it didn't go somewhere. And it certainly reaffirms that the silo activity doesn't work.
Yeah, it's interesting. Some of the comments on LinkedIn, and if you want to comment on this, every day I post some of these stories and open it up for discussion. And you just follow me on Bill J. Russell on LinkedIn. This is from Dan Howard, and Dan is a CIO, and he made the comment that, let's see, where does it start? Here it is. I was excited about the potential of Haven to disrupt and move the needle, but in reading some of the fallout information, it's not too surprising. Man, I can't read today. Sorry, I need my glasses, I think. Some of the fallout information, it is not too surprising. It almost seems like they were more of a healthcare think tank rather than an operational unit that worked cohesively. And that whole idea of silos, I think, really drives this home. And you made that point in that there were times where like you would see Amazon came out with their new program for their employees. And I asked somebody from Amazon, I'm like, so is this part of Haven? They're like, oh, no, not really. This is just something we're doing on our own. And I thought, well, that's interesting. That's almost what we expected Haven to do. And then they did something else around pharmacy. And I'm like, so is this in the Haven thing? They're like, oh, no, this is something else we're doing. And you start to scratch your head and go, okay, what exactly is Haven and what are they doing? And I think he captures it in that whole think tank comment. That's really what they ended up doing. It is kind of disappointing. I agree with you that it was a good pick, and I thought he was going to take it in a good direction. But I think what you saw there is you take the cultures of three very distinct companies, very large companies, and you try to satisfy too many masters there, and they just weren't able to all get on the same page. So that, I guess, is not overly surprising that ended the way it did. Any implications for health IT on this? I mean, should we read too much into this that, healthcare change is going to have to come from the provider or the payer? Is that what we should read into this? What should we read into it in terms of where change is going to come from?
That's a great question, Bill, because if you look at the ecosystem in terms of healthcare, you've got the government, obviously, that plays a role. You've got providers, which are delivering healthcare, and you got, payers in terms of insurers. And then you've got everybody in the supply chain in that ecosystem who is, providing some kind of product or services within the healthcare delivery. And then you've got, in this case, it was huge employers, right, who wanted to make a difference and make changes for their organizations and then roll it out. So really, they all have to come into play, all of those parts of the healthcare ecosystem. And, having spent most of my healthcare IT career in a provider organization, I put providers who are actually delivering the care to the patients as, really front and center in that.
Yeah, absolutely. All right. So stories to get through. Which way do you want to go? Do you want to talk about the COVID vaccine distribution? You want to talk about the changing role of the CIO? Where would you like to go next?
Let's talk about the vaccine. I think it's the most interesting story. And though, as I thought about it in advance, trying to tease out what's relevant news versus our opinion. And I know you have a mix on this show.
Yeah, no, absolutely. Well, part of it is us trying to provide context to it. And so gosh, man, I read articles where doctors don't know where to go to get the vaccine. And then I read articles where, we're trending in the right direction and we're heading towards a million vaccine. I'm going to get this number wrong. 1 million a week, 1 million a day.
A day.
Million a day.
1 million a day.
Yeah, we're heading in that direction is what we're seeing. But we're also seeing it's just exposing a lot of vulnerabilities, a lot of things that we don't do well between public, private, and this is really flexing a lot of new muscles. What specifically are you reading or hearing about in terms of the vaccine distribution?
Well, let me go from great optimism. This is early January, over a month ago, prior to the first vaccine in an arm, to what's really happening now. And my great optimism, a month ago, I listened to a podcast. I'm a fan of Andy Slavitt's In the Bubble podcast. I bounce between yours and his on my daily walks, not each walk, but day to day. And he had a excellent podcast on vaccines, a senior person in CVS and another expert physician. I can't remember exactly his role. And when the CVS person talked about, we have 10,000 distribution points, right, around the country. Assume Walgreens has some similar number. Don't quote me on this, but I thought he said we have 100,000 people to put, vaccines in arms. And the app they had ready for scheduling, reminders for the second dose, everything else. I'm like, okay, this is good. This is, widespread to the general public when it's our turn. What's happened seems far different than that. I haven't seen in the news yet what they've been able to do and stand up. It's gonna, if it's okay, you can bleep it out later, but it just seems to me that it's a bit of a cluster in the way that testing was a cluster nationally. And there's a huge dependence on the states and the public health infrastructure, which is extremely taxed. And I think it exposes so many holes. I know you, in the article that you shared, it highlighted a couple key things in terms of IT, but it exposes holes in our logistics, our ability to provide the staff, track the data. This is where a country that's got a national health system is probably going to do far better in terms of getting shots in arms at the scale that's needed.
Yeah, I mean, the article I highlighted talked about some of the IT data challenges, and this was from the Harvard Business Review. Yeah. They talked about 4 steps that must be taken: standardize the way personal health data is exchanged, align states' immunization registries and state and federal reporting analytics, design immunization passports that are portable, equitable, and protect privacy, and address privacy, portability, and cybersecurity trade-offs. I highlighted that. That was one of the stories I highlighted early in the week. One of the things I highlighted later in the week was I received an email, and the email was from my homeowners association. And I was kind of surprised that was the mechanism that was used. But the local health system that has the vaccine, and this is one of the things that's a challenge, not every health system got the vaccine in every market. In fact, a single health system was chosen. So if you're a provider with another health system, you might be sitting there saying, hey, my health system doesn't have the vaccine. But in reality, you could go to the other health system as a frontline care worker and get the vaccine. That is part of what they are supposed to be doing, is communicating within that market that, hey, the vaccine came to this health system for the entire community. And the care workers are first in line, absolutely the case. Right. And then second is, I think, people over the age of 65. According to this email I got, was, hey, these are at least in the market that I'm in. And this is part of the challenge, right? It's market specific. So the health system in our market did a great job of communication. They set up locations, they set up scheduling, they got the email out there, they utilized distribution lists that maybe are not normal for health systems to use, like my homeowners association's list. And I think they did a good job in getting the information out there. So it's interesting when I read some of these other articles and I go, wow, how can it be that in this community with a fairly small health system, I mean, I'm talking about a health system that's probably, teetering a little lower than $1 billion a year. So not a ton of resources. They even don't have a CIO. They have a director of IT who acts as the CIO. I mean, we're not talking a major health system, but I look at the logistics that they put together and it's spot on. Okay. So if you go into other markets, if you go into like a North Carolina and you give it to Atrium, and you go into Seattle and you give it to a Providence, I would suspect that they have that, they should have the resources to really wire that better, or is it just the scale of it is that much harder to overcome? What are your thoughts around that?
So I think that's a good point, because and you just named 2 leading organizations, Atrium and Providence, and there's probably many others across the country that if they were somehow responsible for the broader distribution than just their own frontline workers and employees, that could be a positive thing. Maybe them partnering with these huge pharmacy chains, right? Which from a logistics and geography perspective, everybody lives within some short distance of one of those, probably, right? One of those pharmacies, but right now it's up to the states. The states had to submit a plan. The states can interpret the CDC guidelines or apply the CDC guidelines in terms of the groups. So, you said where you are, it's over 65, but they're broken down into other groups over 75 and then 65 to 75. A couple anecdotes, just how the states are dealing with it. We saw where you are in Florida, very long lines, right? And very elders out overnight waiting in line in their cars or on the sidewalk. So that doesn't sound like a very workable solution.
And you know what's interesting about that? In my email, it said, you'll schedule it. There's a time. There is no lines. In fact,
Yeah.
they said there will be no lines. So it's
It has to
interesting.
be scheduled. It can't be first come, first serve. I mean, to line up, it has to be scheduled. So I talked to my sister. I'm from Minnesota and my family's all there. I talked to her yesterday. She worked in public health department for many years in a leadership role. And she said it's clear what the groups are, but not the execution at this point in Minnesota. She's retired now. So she was going to send a letter to her colleagues in the public health department saying, what's up here? This doesn't seem to be getting executed well. She told me about an in-law in New Mexico. All they had to do was sign on to go online, get into a registry, give their birth date. They're probably in their 60s, and they got an appointment, right? And, so it's all over the place. In Rhode Island, where I am, I keep checking rhodeisland.gov. There's some broad sense about the groups, but still no information about execution, so to speak, beyond, the frontline workers at the hospital. So
Yeah,
it needs a lot of work.
Well, here's the interesting thing to me is, there's so many interesting things here. First of all, I have no patience for political hacks. I just don't, from either side, quite frankly. I don't have a patience for the people who are taking pot shots at the New York governor, and I don't have a patience for the people taking pot shots at the Florida governor, because we have a job to do here, and that's to get the vaccine out to everybody that we can get it out to. And at the end of the day, what this comes down to is the governors have looked out, and their plan is, okay, we're going to get it in the hands of the health system. So let's look internally at us. What do we need to do? First of all, we need a good communication plan.
Yep.
And one of the challenges I have found with a lot of health systems is that the marketing arms are still maturing. It used to be that, marketing was just, buy the baseball stadium moniker and you did your job for the year and you had brand awareness. Well, the pandemic changed everything. It's like, all right, we had to get information out on what does COVID-19 mean? What does it mean for our community? What is social distancing? This was a new term for us back in March. We didn't really know what it meant. But what is mask wear? This was all these things that people were looking out. And I guess you could look at Google, but a lot of them were saying, look, I'm going to go talk to my doctor. I'm going to talk to my health system. And so a lot of that really stems from obviously operational teams coming together and saying, what do we need to communicate? But then it's handed to the marketing group to say, okay, get this out into our community, get it out through, get us on the news, get us in social media channels, get this information out. And a lot of health systems were sort of trying to build this as they went. All right, well, this is the final exam. The final exam is, hey, we've been doing this now for the better part of 9 months, almost a year. And the final exam is, all right, let's let everyone know how to get the vaccine, where to get the vaccine, what the differences are in the vaccines, what a 2-dose regimen is, get this information out. And, from what I can tell, in the community I live in, it's pretty well wired. It looks pretty good to me. It has a scheduling program. Now, one of the things that we've talked about was the scheduling they're using is Eventbrite. And I'm like, okay, I understand the security problems with it, but if you asked me to put together a scheduling program and I couldn't use my portal because this is not only for my health system, but for the other health systems in our community, then I'm going to look to the cloud and it's either going to be Eventbrite or Calendly, or it's going to be something like that. So at the end of the day, that's the way they went. It looks wired. But then I read these other stories and I'm going, wow, this really, but I'm not sure I'm blaming the governors. I'm saying if they've passed this down to the health systems, we need to look at the health systems in those local markets who got the vaccine and evaluate, were they the right people to get the vaccine? Because they don't know how to communicate with the community, to put the process in place, to communicate with the other health systems, and to set up the logistics to have this done. Yeah. I think there needs to be some accountability. I hate to be the one taking health systems out to the woodshed because it's been a significant challenge, but we knew this day of delivering the vaccine was coming. We should have been ready for it.
So I totally agree with you that we knew this day was coming and we should have been ready. At the same time, if there had not been a pandemic and everybody said, we need a really good, smooth, well-orchestrated flu shot the month of November 21 for everybody, right? And we can plan for it. That could probably happen in a better way because the resources and people who have had to focus on, let's make sure the vaccine distribution and shots in arms goes well, have been very focused on testing and treating, right? So everybody involved in this is very taxed. So additional resources, where do additional resources come from? So, but I agree with you that planning should have been happening. And if you think about it, there's, what are the delivery mechanisms at this point? There's provider organizations. And should I be able to go to my provider organization portal online and say, ask the question and find out when as a patient within that system, could I possibly get it through my PCP if that's an avenue? Should I be able to go, in my case, it's Walgreens where I get my flu shot. Should I be able to go online at Walgreens and say, that's my Walgreens on Main Street in Providence. When can I get my, not flu shot, but my vaccine? Or should I be able to go on rhodeisland.gov and find out where's mass distribution for vaccine happening in some parking lot somewhere or some convention center, right? I mean,
Yep.
You talk about the push in your community and your story about the email and the homeowners association, but there's also the pull because at this point, doesn't everybody who believes in science and trusts it want to get a vaccine? So we'll go find the information and get it done when it's our turn.
Yeah, I agree. I'm going to hit some of these comments here. I know that some of my regular listeners actually work for state governments and they'll give me a call on this, but I think the states have fallen down as well. Now, my local county and my state actually, and I know Florida takes heat because it's a Republican state and it takes heat from the other side, as New York takes it from the Republican side. But at the end of the day, I can go to the Florida website. I have tons of information. I can go to the county website and there's tons of information that tell me what to do. It would be interesting, and I'd be curious right now. If I had a staff to do this, I'd send them to all 50 states because you know what? 25 to 30% of their traffic on their website today is people trying to figure out the vaccine. So I would think there would be a banner on the state website that says, if you are looking for the vaccine and how to get the vaccine and what our guidelines are for our state, click this button. And it would be interesting to see how many of the 50 states are even remotely close to that.
Yep. So I'll tell you, because I just went to our rhodeisland.gov. It was 2 or 3 clicks before I got to the COVID-19 vaccine. And it's saying final decisions have not been made about who can get vaccinated in each phase, which seems to me, I don't know why that is. This should have been done by now. And if the decisions haven't been made about when, then I assume the decisions about where and how has not been made either. And it's disappointing because Rhode Island did a really good job on testing and really led the way in numbers of testing. So I was optimistic about the vaccine, organization. But
yeah,
I'm not gonna throw blame on any one place or person or role. We can do better. We need to do better.
Yeah, no, and I'm throwing a bunch of blame around just only because it feels to me like we had a 9-month head start and we could have. It's not hard to section off a group of people and say, and it doesn't even have to be, physician and frontline care workers are caring for people. They're doing testing. I get that, but you have administrative staff. You could have taken your population health person, somebody from IT, somebody from marketing, whatever, put them in a room and said, look, a day's coming when we're going to get a vaccine. It's not going to be in huge supply on the first day. So we're going to have some limitations. We want different options for you. This is what our CEO at my last health system would have done. I just know it. Fred Dempster made a comment. This has been made more challenging by governors and related micromanaging. The data infrastructure in a maturity model is or just above feeble. And I think, that's how people feel about the state. I have talked to some CIOs who have struggled with the state in terms of the reporting requirements and things they've been asked to. Dr. Lucienne Ide, who's been a guest on the show with Remedy, says the 2-dose requirement with different timeline per manufacturer makes us even more complex, especially when we don't have a good track record of 2-dose vaccines in the adults in the US. And then she talks about how they're helping to bring people back for that second dose. And we have enough trouble, as you mentioned, with the flu vaccine. This is a 2-dose regimen. And if you don't get the second, you might as well not get the first. So and Drex and I talked about this. In some cases, what they're doing is they're just handing people a card that says, on this date, come back. And people are putting that in their wallet. That's the point. That's the point we're at. And this is going to be interesting for us. Do you think this is being tracked in the EHR? You think that's how we're tracking this?
Oh, I would assume, yeah. Well, so again, if you're a hospital employee, it's probably being tracked through Occ Health, and you know the separation for employees between the Occ Health database and the EMR. If you're getting it through your provider, it's being tracked in the EMR. If I eventually can go to Walgreens or CVS and get it, then they're just going to have it in their system, and I'm going to have to tell my doctor, right, that I got the vaccine. So, if it's at some mass vaccine place set up at a convention center by the state, I don't know where it's going to get tracked.
Yeah. Well, CVS is going to put it in. It's going to put it in Epic, and it'll be interesting to see where we build the registries from.
Yeah. Who's going to put it into Epic? What'd you say?
Well, CVS has Epic, so they'll probably put it in there. So
that's true. Yeah.
All right, you and
I aren't going to solve it. There's much work to do, and we got to get shots in arms. Bottom line.
Yeah, as is usually the case, we've spent a lot of time on the first two stories. I just quickly want to touch on Optum bought Change Healthcare, a $13 billion deal. And, United Health Group just keeps getting bigger. It's a $250 billion company. And, if they're in your market, they just acquired some new capabilities. They continue to grow out their health network. So it'll be interesting to keep an eye on the people that are sort of positioning to be the national delivery arms, United Healthcare being one of them. Walmart's actually trying to position to be one of them moving forward. There's others. There's large players, obviously, Ascension, you have, HCA and others, which are large, but they don't necessarily have all the capabilities that you see in a United Health Group in terms of their payer capabilities, their technology mix, and those kind of things. So it'll be interesting to keep an eye on them. I want you to tee up one of your stories. So which story would you like to tee up?
Am I only going to get one?
We'll start with one. We'll see where it goes.
Okay. Just in terms of the timing. Well, let me go to the one that's introducing, I think, a good resource to your listeners. The article is for older adults, the home is becoming the hub for life and care. And this is by Jane Saracone-Khan. She also she really deals at the intersection of healthcare and economics, and has a popular blog called Health Populi, does a lot of research in this space. And in this article, she highlighted research report by Lori Olive called The Future of Remote Care Technology in Older Adults, Connection is Everything. I pulled up the report after reading Jane's article, but didn't get through the 25 pages of it. But it's interesting here in terms of what's happened with virtual care for elders. And in that article, she talks about telemedicine unreadiness. She talked about a number of options to connect older disconnected health consumers, including leveraging their televisions, the voice tech digital assistants like Amazon Alexa, adapting FaceTime and Skype type calls. She also talks about for people over 65 who experienced a virtual care visit during the pandemic, just how those numbers on a number of metrics were so much higher than they would have been in 19 in terms of their interest and their adoption. So that is worth looking at. And she closes on, while we're still in the midst of battling the coronavirus, which is hitting older people in America especially hard, Orlov's report gives us a hopeful roadmap to rebuilding care in a better, safer, more cost-effective, humane setting, our homes.
Yep.
Many building blocks of the technologies and applications are available now. Analytics and virtual reality and augmented reality are evolving, spurred on by the public health crisis. So I will at some point read the full report. I'm definitely interested in this area, but wanted to share that much. What were your thoughts on that?
I appreciate you sharing this resource. I scanned the report. There's a couple of things that jumped out.
Okay.
They talk about loneliness and isolation, which I think is an epidemic in America, not only among the aging population, but also, quite frankly, I just think it's an epidemic in general. I run into people all the time and just try to have conversations and figure out who their net is, who the people they talk to when they have a challenge or a problem. And a lot of people just do not have, the older they get, you're just surprised at the fact that they don't have best friends and they don't have friends. And you're just sort of, and this epidemic, this pandemic did not help that in any way. She has some numbers. October 2018, 34% felt a lack of companionship. In June of 2020, 41%, 27% felt isolated from others. In October of 2018, 56% in June of this year, 28% had infrequent social contact, 46% this year. And, that's the situation my parents are living through right now. They're pretty well isolated. They are being good citizens. They are taking care of themselves. They, did Christmas via, it wasn't Skype. It was probably Zoom if I thought about it. And, all those things are hard for them. They did not go to the place they normally do. And anyway, when you're talking about the aging, that's one of the things. All right, so we connect them through digital. And this research does a great job in sort of pointing out some of the challenges we had bringing that population in. And it was, as you mentioned, the fact that in some areas, the bandwidth just wasn't there. In some areas, it's training and helping them to make those connections. The reality is during the pandemic, the policy foundation was changing as we went along. So health systems were adapting and we just didn't have things that were baked, easy, that they were used to. And I really love this research. I mean, it talks about this growing, what they call elder orphans that leads to even greater risk of isolation. This is a really good report. I'll probably post this in some way in the show notes so people can reference it. It's really good.
Excellent. Good. I'm glad you picked up on the loneliness part of it. I don't know if you were at the Chime Forum a couple of years ago when Vivek Murthy spoke.
Yep.
He spoke about that. That was an incredibly powerful talk. He's got a book. I don't know if you know the name of the book. He focused on this in terms of loneliness. And as we know, he's nominated to be the next U.S. Surgeon General again. But this issue needs attention. Absolutely.
Let's touch on your last article. So your last article is interesting, and we'll continue to hit on this throughout the year.
Okay.
The CIO role is changing. So what do we expect in 2021 and beyond?
Yeah. So this article, this was in Becker's, the CIO's transformational role. 3 execs share how the position has evolved to COO by proxy. And there's a Gartner reference here. By 2024, 1/4 of CIOs working in large traditional enterprises are expected to become the COO by proxy, oversee operational responsibilities, including recommending enterprise digital projects for approval, decide which activities to fund and those that should be discontinued according to research and advisory firm Gartner annual report on healthcare. I always thought when I was a CIO, everybody wanted to report to the CEO. I thought if you can't report to the CEO, which is okay, you want to report to the COO because the COO has the broadest view across the organization of every component. And what do CIOs need to do? They need to be across the whole organization with a broad view and support all of those, right? As well as looking ahead. So I see that connection between the CIO and the COO. I can see the CIOs taking on far more operational responsibility. I think that they have stepped up, and kudos to them. I am in awe during the pandemic to take on a broader role and really deal with a lot of logistics and operational issues. So I think you see evolution there. I think you'll see evolution in terms of more CIOs becoming what some have called the double CIO, the Chief Information Officer, the Chief Innovation Officer, the Chief Information Officer, and the Chief Digital Officer. I think expanded role, no question. And it'll depend on the organization, depend on the individual in terms of their aspirations, where they want to focus, and where they can do the best for the organization.
Yeah, it's interesting. Just a couple of examples to close that out. I read an article where, and again, I'll ask him when he comes on the show. It appears the Providence CIO is also in charge of all real estate. That's interesting to me. Chad Brizendine actually at St. Luke's in Pennsylvania took on frontline revenue responsibility. He's in charge of actually the entire service line around radiology and imaging is part of his role. So he actually took on a revenue line and those kind of things. So that's interesting. Sheesh Treja was just hired away from Mount Sinai to UC Davis, and he's going to have the dual role, the CIO role. Gosh, I'm trying to think. There's a couple of examples. of that's going on. So I think that's one of the things that's going to happen this year is we are going to see dual roles, either towards an dual operational role or a dual innovation role. And I agree with you. This will be the year that more things, can you imagine more things getting put on the CIO's plate at this point?
Yeah. So, I mean, two things along those lines, when I think about it, I think that maybe this year being that year, cost is going to be a driver. And it made me think about it. There's kind of been, I don't want to call it title inflation, but you read about so many new chiefs within organizations. And can organizations afford that many people at that senior salary level? Or will there be some consolidation of roles? Right? So I think that's one factor. The other, when you say, can you imagine taking on more? This is where, and you and I share the commitment, next generation leaders, this is where that leadership level under the CIO, whatever the CIO's broad role, expanded role may be, is so critical. If you don't have those strong people leading in their areas, then no, you as the CIO can't take on more.
And I'm reminded of a conversation I had with Stephanie Reel, and she was talking about her organization. And I think her successor will probably come out of her team, because she had such a great team underneath her of about 6 people that were direct reports that were running large parts of the IT organization. And that's what it looks like. I think we are seeing more CIOs elevate from within the ranks when those positions become available. It just makes sense.
Yeah, I've been tracking that. Every time I see some kind of movement, CIOs moving around, and oftentimes, to say second in command, whether that's a good way to put it or not, is pulled up to run things. And in many cases, they are then becoming the permanent CIO. So that's great. That's great that people are being developed and moved up.
Yep, absolutely. Well, that's what we saw at Cleveland Clinic. I think we'll see that in other places. Sue, thank you very much. We will get better at this. This was, we tried to cover 5 stories. I think what we learned in this, we can only cover 4 stories. So we'll get a little better. But, that's all for this week. If you know someone that might benefit from our channel, please forward them a note. They can subscribe on the website, thisweekhealth.com, or wherever you listen to podcasts. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders: VMware, Hill-Rom, and StarBridge Advisors. We have a new schedule for our podcast for 2021. Monday is news, Wednesday is Influence, our solution showcase, and Friday is the Influence. So be sure to check back for more great content. Thanks for listening. That's all for now.